It is my honor now to launch this report.
The Permanent Secretary at the Ministry of Health, Dr. Dana Atwine, officiated at the release of the Uganda Law Society report on the rule of law at the 13th Annual Symposium. Special attention at the meeting was on the right to health.
So I want to see how do we deal with the right to health equitably and ensure that everybody is treated equitably.
There is nobody better situated than to come and share with us what government is doing in implementing court orders on the right to health.
The Constitutional Court judges ordered for production of audit reports on maternal health care for 2 financial years starting 2020-21 to Parliament with a copy to the court.
We are just a few months late because we were supposed to have done it at the end of the financial year. The COVID lockdown for those months had a bearing.
The court ordered the improvement of maternal health care through the provision of adequate funds in the budget, training of all maternal health workers, and equipping health centers for 2 financial years. They state that training of some 734 health workers was achieved through the award of scholarships.
A total of $2.8 million was allocated for this to cover nationwide. So they've availed an entire table of what was trained in, how many people were trained, what were the courses.
The state finds the implementation of the court directive on the mandatory improvement of the maternal health care a tall order.
Even when you are in a family, you always plan for your family, but sometimes it doesn't. It depends on what you have. But it is our wish. It is reflected in our NDP 3.
Atwine says at least 78% of the population are now able to find health facilities within every 5 kilometers. The sword hanging over government's head was a result of a landmark unanimous judgment of 5 judges of the Constitutional Court in favor of a petition filed by the Center for Health, Human Rights and Development. The families of the 2 mothers whose demise was subject to litigation from the negligence of health workers are yet to receive the 70 million shillings awarded to each for psychological torture and another 85 million shillings for exemplary damage for the loss suffered. Jackson Onyango, NTV.